Well, Mike, thank you, and good morning, everybody. You're never sure what you want to be in this business, but I have a choice of being a celebrity or a chance of being a general. What I really want to be is a hockey player, because I grew up playing hockey in the arena just a few steps from here, not playing very well, for that matter, because others have gone on to play in the Stanley Cup from this arena. But we're here today to talk about what's happening here in North Toronto, but also right across the city in terms of a campaign that we have to get people vaccinated and to make sure that we carry out the job. I should make one correction to Councillor Colle. I don't correct Councillor Colle often, but he indicated that Commander Wionsnack was from the fire, and in fact he's from EMS, and I know from all these different services they all work well together, but they take this very seriously as to who's from where, and that's where he's from, and he's done an excellent job as part of an excellent team, and the leaders of that team, and they'd be the first to say the leaders of a large number of other people are standing behind me in terms of the effort that we've made that put us in such an excellent position in terms of what we've achieved so far with respect to vaccinations in the city that are such a key to the good health of the people of the city and to the good health of the city's economy. And we have indeed today, just today, reached another milestone that is so important to the City of Toronto and to the people, the residents of the City of Toronto, and that is that more than 3 million doses of COVID-19 vaccine have been administered in the city, and this is the most of any local health region in all of Canada. These doses have been administered, of course, at city-run clinics like this one, but also at clinics run by our hospital and healthcare partners and at pharmacies right across the city. And I think it's important to note this has been throughout, and we've described it as such, a Team Toronto effort to get this job done. It has led to more than 75% of adults in the city already receiving at least one dose of the vaccine, and that's a threshold we passed over in the last couple of days, and 30% of the adults in the city have received 2 doses, and that is something that went up 5 points in the last couple of days alone, from 25% to 30%. And another thing to note, and it's to commend the younger people in the city, that 60% of young people aged 12 to 17 years of age in the city have been vaccinated. So I think by any measure, our vaccination program in the city, and if you think back, we didn't even have a vaccine not that many months ago. Then there were vaccines that came on the scene. The city had been doing the planning to make sure that we had the clinics in place, our own and others in conjunction with our healthcare partners, with a very special and targeted program to make sure that those communities that had some hesitancy or some barriers in their way to get vaccinated had extra help from the city, and I think we've done a very good job of that, and this all represents great progress. But people should make no mistake. I don't ever, when we come out and talk about these milestones, and we've had quite a few along the way from a standing start with 0 vaccinations done by 0 clinics and all the rest. We've done well to get to 3 million doses administered as of today. But you don't see me or my colleagues coming forward to announce these things in a celebratory way, even though we're very grateful to everybody who's been involved in this. And I do want to thank every single person who has stepped forward to get vaccinated, because it would do little good for us to have all these clinics with great staff if nobody came forward to get vaccinated. And of course I want to say thank you on behalf of the entire team that works at City Hall to the staff in the clinics, and they consist of some of our own staff, many of whom have been redeployed to work in these clinics, but they also consist of people who work for the hospitals and for the community health organizations, and they've been a huge part of the effort that we've made to get shots into people's arms right across the city. This is, and we knew this from the beginning that it would be, this is the largest vaccination effort ever undertaken in the history of the City of Toronto. Just like the pandemic is an unprecedented thing, at least in the last 100 years in the history of the city. And of course, we want to get everybody vaccinated, but the workers and the volunteers have been instrumental to getting us to where we are. So when I say the mood isn't celebratory, it's because instead we hit 3 million doses with determination and resolve to get the rest of the way to where we have to be. We still have much more important work to do, and that is what we're here to talk about today. I want to take the opportunity again as the Mayor, and you'll hear further encouragement and a scientific and health-related explanation from Dr. de Villa, take the opportunity again to encourage people to get vaccinated. And I do that on behalf of all of our health and community partners, as well as on behalf of Chief Pegg, who's done so much to help with the logistics of making these clinics possible and making it all work in terms of working with the province on supply and so on, and of course Dr. de Villa as well. The message to Torontonians is very simple. Please get your first dose, and if you've had your second dose, please make arrangements to get your second dose, because you are not fully vaccinated until you've had 2 doses, and for that matter, it's important to remember that even the added protection offered by a first or second dose doesn't really kick in until sometime after you've actually had the injection, and so that there's a planning period you have to go through to, if you have a seized of a sense of getting on with this as we are, to get that done sooner than later. The vaccination will protect you against COVID-19 and the Delta variant. It will help protect your friends and loved ones as well, which is very important, and your co-workers, and it will protect the progress that we are making in trying to bring this pandemic to an end, because we are making progress. You can see that from the early stages of reopening that have happened. More than 8,761 people have already booked appointments for this Sunday, which is a big day for the city when we're trying something a bit different, which is a big immunization, big vaccination day at the Scotiabank Arena. We're doing that in partnership with Maple Leaf Sports and Entertainment, with some of our hospitals, and of course with the City of Toronto itself. And it's a Toronto Vaccine Day that is aimed at getting thousands of people, thousands upon thousands of people, vaccinated in this one-day event. And we're calling it the winning shot. We're calling it the winning shot. I have myself booked an appointment there on Sunday early in the morning to get my own second dose. And I'm looking forward to being part of this event, where we hope to set a record as to the number of people that are getting vaccinated in one place in one day at the Scotiabank Arena on Sunday, starting early in the morning. I know that people want this pandemic to be over. I know that. I hear it every day. I hear it sometimes just as a matter of aspiration, but I hear it other times as a measure of real frustration, and that includes people in business and people who haven't been able to work, people who cut hair and just haven't been able to do their job for so long now. So people want, for a variety of reasons, to get this pandemic over, and that is why I am so determined, together with other members of our team, to make sure that everyone gets vaccinated. And so it's why the city is working as hard as it is to make sure people have the information necessary about how to get vaccinated. And you can still go, as you have been able to do all the way along, to toronto.ca/COVID-19 to get all of that information. We have solid momentum here in the City of Toronto, solid momentum, maybe among the best in the country in terms of just how well we're doing at getting people to come out and get vaccinated, and sometimes taking the vaccinations to them when they have particular needs that we have to fill. But we've got to keep that momentum going for the sake of your health. It's for the sake of your health, and so that we can get the city open again. But it starts with your health. You know, we've said all the way along, you can't have a healthy economy without healthy people. I mean, if nobody's healthy, then who's going to be in the stores to serve you? Who's going to be the customers going to the store? Who's going to be the owners of the business trying to keep them going? So our city clinics are now administering Moderna or Pfizer interchangeably, and that is based on questions of vaccine availability. And we don't control that, but we are dealing with it and keeping the momentum going by dealing with the Moderna or Pfizer interchangeably. And our health officials are clear, as Dr. de Villa will be this morning. Both Pfizer and Moderna brands are mRNA vaccines and are extremely effective against COVID-19 transmission. Getting vaccinated with either Moderna or Pfizer will better protect you than waiting or not having any vaccine protection from a first or a second dose. So please, don't hesitate and get your shot with the vaccine that is available. I want our vaccine numbers to be very solid and well ahead of the required thresholds that have been set as part of the provincial reopening plan, not because there's a competition on, but because it will keep people healthy and drive positive provincial numbers so that we can get this city open, get businesses reopened, get people back to work, and get our lives back to normal. That's why we want people to get vaccinated, starting with your good health and the good health of your family and friends and co-workers, but moving through to getting this city back to normal, getting businesses open, and getting people back to work. And so to offer you some further comment and reassurance with respect to the interchangeability of vaccines and what we're dealing with on that front now, I would call forward somebody who has become a celebrity, but much more important than celebrity. You're not worried about celebrity, you're worried about professionalism. And she's a consummate professional whose advice you can trust when you hear from her about vaccines or anything else, and that's Dr. Eileen de Villa.
Thank you very much, Mr. Mayor and Councillor Colle, for the introduction. And thank you for those of you who are watching us here today. You know, we've been to a number of the clinics, the mass immunization clinics that we are running here at the city. And every time I come to one of these, I'm really struck, and I think about how very fortunate we are. And I'm struck by that feeling again today. We are incredibly, incredibly fortunate in this city. You know, it wasn't that long ago, if you think about it, when we were in the height of the earlier waves of this pandemic, that we wondered about the availability of vaccine. When might there be a vaccine to help protect us, to protect our families, to protect our communities? And, you know, I still think it is. You've heard me say it before. You will hear me say it again. It is a miracle of modern science that in less than a year, we have a number of vaccine products available to us that have been proven to be effective protection against COVID-19. I continue to be incredibly grateful and truly amazed at how fortunate we are to be able to have these products. We wondered whether they would come. Early on in the year, we wondered about their availability and supply. And now we find ourselves in the enviable position, and there are many countries around the world that are much less fortunate than we are. But we do find ourselves in this very enviable position of having supply to be able to run clinics like this, to have vaccination partners all around the city also providing vaccines that we know are effective and safe and provide us that very much needed protection against COVID-19 and a path forward to the other side of this pandemic. You know what I would further say, I think the Mayor covered all the key points. He's become a bit of an expert, maybe not a general, but certainly becoming more and more of an expert in respect of public health practice as it applies to COVID-19 in particular. So I would just add this. We are in a fortunate position to be able to have supply of mRNA vaccines that again have been shown both in clinical studies and in real-world experience to be highly effective and highly protective against COVID-19. We know that it works, and we know that we as well have scientific guidance courtesy of bodies like the National Advisory Committee on Immunization, and knowledge, real-world knowledge and experience to support our ability to interchange these vaccines. We know these vaccines work through similar mechanisms, and we know that we can interchange them safely in order to provide that protective benefit of mRNA vaccines to all of us in our community, and again, to get us to the other side of this pandemic. I'm so pleased that we are seeing people taking advantage of that opportunity. The Mayor spoke of the now more than 3 million people in Toronto that have had at least one dose of vaccine and soon will be on their way to getting their second dose. So I can't say enough. Thank you to everybody. Thank you to those who make these clinics happen. Thank you to Torontonians for coming to these clinics, for rolling up your sleeves, and for taking that step, the best step that you can take to protect yourselves and to protect our entire community. So with that, I will thank you for your time and will look forward. I know I can speak on behalf of the entire team and all our vaccination partners around the city when I say we look forward to seeing you at one of these vaccination tables, getting vaccine and getting that protective benefit that's provided by vaccine. Thank you.
Thank you, everyone, and thank you for joining us today. We will now open the floor to questions. As a reminder, it's one question, one follow-up. Please unmute yourself before asking your question. First up, we have Simon from CP24. Please go ahead.
Yes, I'll begin by saying that we have acknowledged and accepted throughout the responsibility we have to help find safe indoor housing for people experiencing homelessness. It's a very important task that the city takes very seriously. And I will say that in that regard, over a period of time that we've been working on this, hundreds and hundreds of people have been rehoused from encampments into hotels and other safe forms of accommodation. We have made, as a city, 20,000 visits to these encampments, to people resident in these encampments, persuading them to come indoors. But the fact is that there have been hundreds of fires take place in these encampments. Some people have lost their lives. The encampments are not healthy. They're not safe in a number of respects. And so there does come a time after 20,000 visits and months of very patient persuasion of the people experiencing homelessness who have some issues in their lives, there does come a time when you have to move to make sure that those people are kept safe and are kept healthy, and that the parks are available for use by all of the people who those parks belong to, everybody in the City of Toronto. And so all I can say is I don't make decisions about when laws are enforced in any regard in the city. Those decisions are made by enforcement officials, but I support what they're doing, which I think they're doing today. Already today, 3 people have been persuaded, I think it's maybe up to 4 now, to accept indoor housing. That's the first thing we did when we went to the site this morning. When I say we, the city, was to say to people, please, come indoors. We have hotel rooms. We have other kinds of supportive housing that you can use, rather than be here in the park where this is no place for people to be safely housed. And so I support the actions that are being undertaken today. I think it's being done in a measured way. And I hope that everybody, including those who advocate for people experiencing homelessness, will cooperate with the city in doing what has to be done in the best interest of the safety of the homeless people themselves and the best interests of all of the people of the City of Toronto.
Next, we have Brian from the Toronto Sun. Please go ahead.
Hi, it was Brian you just called, right? Sorry, I could hardly hear you. Question, we're seeing a gradual easing of COVID measures in areas across Canada, with Alberta just a few days ago announcing the end of their measures by Canada Day. This news and celebration about record numbers of vaccinations is great, but at what point will we learn what benchmarks Toronto has set on when we'll start seeing the loosening of restrictions here in the city? When will we start seeing something more than just celebrations, backpatting, and congratulatory tweets about the number of jabs going in arms?
The sound is a little bit muffled in here, but I sensed what you were asking about was when we're going to see some celebratory kinds of occasions here in the city, and that this relates to the lifting of restrictions. Did I get the question by and large right? Okay.
Yeah, like when are we going to start learning about when we're going to start seeing some easing of restrictions here in the city?
Well, let's start with the fact that the rate of vaccination, where we're doing well and frankly have met some of the thresholds necessary for a liberalization of the health requirements, is exactly why we're here today, to say to people the best thing we can do, both to keep people healthy and fight off this Delta variant and to promote the reopening of the city, is to get vaccinated. And so we hope that that will continue, and I think that will make it much easier for the province to take a look at moving from one stage to the next, and perhaps even doing so in a fashion that is faster than the timetable that they have set out. They have, the province, set out a roadmap to reopening. It has time limits and time periods in it that are prescribed between stages. I think there is the opportunity for those to be shortened, but I think in the end, I understand their caution in making sure that when they have a plan that most people applauded, including public health officials, that you try to stick to that plan and make certain before you make any move from one stage to the next or change around opening times that you are in a position where you can be confident in doing so, that we won't have any kind of a relapse. And so my colleagues, the mayors and chairs of the GTHA, the Greater Toronto and Hamilton area, met on Monday and said at that time that they were encouraged at the fact the province was willing to consider perhaps opening personal service businesses for haircuts and people who want different things done earlier. And that is something that hopefully the scientific evidence might allow to be done. And maybe it'll be the case that because of the success of the vaccination thresholds we're here trying to promote today, that other things can be done at an earlier date as well. But I think most people would concur in the fact that we should be careful about this. I want this city, I want the province for that matter, but my domain is the city in terms of my responsibility. I want the city opened up again as soon as it possibly can be safely done. I want those personal services businesses open. They need to be open. Those people need to be back to work. Lots of people are like me and they need a haircut badly. We want those places open. We want the indoor dining open very soon. We see the experience elsewhere where it is being done successfully. We just want to make sure we can match that success and make sure that it's going to be success that is lasting. And there will be celebrations. We've talked. I've made inquiries. I don't want to give away anything that we haven't decided to do, but I've made inquiries about how long it would take, since we've missed fireworks demonstrations on Victoria Day, Canada Day, maybe 2 years in a row. How long would it take to get one organized so that at an appropriate time, when we have something to celebrate, we can do that thing? So I'm mindful of the fact people need that boost, but we just have to be careful. Do you want to add anything from the health standpoint, Dr. Villa?
No, I'm happy to add, but
Thank you. Next, we have David from the Toronto Star on the line. Please go ahead.
Hi, I'm hoping to get to 2 questions in. The first one is about vaccination rates. When I looked at the graph yesterday when it was uploaded on the dashboard, it seemed like in recent days there had been a bit of a dip after a pretty steep curve upward. It also seemed like there might have been fewer health partner clinics. Is there any trend either in first or second dose that says maybe the rapid progress we've been having is slowing down?
So again, the sound is a little off here. So as I understand it, you're asking about progress of the vaccination campaign and the difference between first and second doses. So one, you've heard overall, we've been very pleased thus far with the uptake on the vaccination campaign. More than 3 million doses administered here through the various vaccination partners all throughout the city. A remarkable achievement, largest immunization campaign in the history of this city. And again, a remarkable achievement just to have the vaccines in this short a period of time after discovery of the virus. So I think lots to certainly be grateful for, to be thankful for that we're at this point in the campaign. Certainly as we're seeing the increased or the accelerated eligibility for second dose, I would say that overall we are seeing more and more people presenting for their second dose, which is good news. It means that we're seeing more and more people in our community who are fully vaccinated. And this is incredibly important, as the Mayor made reference to, given that we know of Delta variant, what it has done in the United Kingdom, what it has done in other countries around the world. And we know that having a fully vaccinated population, to the greatest extent that that's possible, is what's going to be necessary to protect us all from negative outcomes associated with the Delta variant, which has been shown to be more transmissible than the variant that caused our third wave, and as well, we're getting some sense that it is leading to more serious illness and hospitalization. So we are very eager to avert that as much as possible by upping that second dose vaccination coverage. That being said, when I last looked at the numbers, and we look at them every day, we continue to see a good uptake in respect of first dose vaccines throughout the city, and we are constantly adjusting our strategies and approaches to make sure that we are reaching as best as possible those areas of the city that require more coverage, whether we're talking about second dose or first dose. We're constantly looking at those data. The data are there certainly to inform the public, but they are also importantly there to inform our own efforts as a series of vaccination partners delivering vaccine, seeking to provide that protection to as many people throughout the city, but to make sure that it is done in a fashion that covers the city equitably so that we all benefit from the protective effects of vaccine. So I hope that answers your question.
It does. Dr. de Villa, can you also address the clearing of the homeless encampment in Trinity Bellwoods? Some people are saying that it doesn't follow CDC guidelines for dealing with such encampments. Are you satisfied that the public health is being ensured for the homeless people and others in the actions the city is taking?
So, you know, what I can say in respect of the circumstances is this. I don't think that there's any question amongst, you know, the colleagues that I have at the city, and you've heard the mayor make comment of this. There's no question that the goal in mind that I think all of us should have, that we need to have as a community, is that we want to see people here in our city, these are members of our community, with access to affordable, sustainable, safe, sanitary housing that actually provides for all their needs. And we know there are many members in our community that require significant supports, healthcare supports, social supports. So I think we should be all firmly working together with an eye towards really achieving that goal. Absolutely, you know, eliminating homelessness as soon as we possibly can, recognizing that that will take the concerted efforts of all three levels of government, and certainly it is a cross-sectoral approach that's needed in order to get to that place where we have sustainable, affordable, supportive housing that meets the needs, particularly of those who are most vulnerable in our community.
Thank you. We're going to circle back to Brian from Toronto Sun for his follow-up question. Please go ahead.
Thank you very much. Just kind of elaborating what David had just asked. Things are just monitoring social media, what's going on in Trinity Bellwoods Park. Things are getting a little tense there. Housing advocates are calling the Operation Evict the Cabinet as a siege. Doug Hatlam just now on Twitter called it Toronto's war on the poor. Where does the line get drawn between balancing the need to keep people safe and the optics of using metal fences and lines of armed police officers to surround a park full of some of our city's most vulnerable people?
The police officers are there, and that's their decision as to where they will be and where they won't. I don't direct where police officers go or what they do. But police officers are there to protect the safety of the people experiencing homelessness and to protect the safety of city staff, because there have been some instances in which that safety has been called into question. So they're there to keep things safe, and frankly, if they can stay back and not get themselves directly involved, I'm sure that's what they'll do. They don't get involved in things they don't have to get involved in. But with respect to you know, people characterizing it in the way that they are, I would just say this. The greatest favor I think we can actually do for the people experiencing homelessness, who have issues in their lives that I think most of us can hardly imagine, is to have them come indoors to a safe place where they can get the kind of support that they need. They're not getting healthy, safe supports in places where there are fires and other things going on, and where it just isn't healthy to be living in a public park, besides the fact that it is illegal to live in a public park. We need to persuade those people, and we've tried everything. We have made the 20,000 visits to talk to each and every one of those people to persuade them to come indoors. And already this morning, some of the people in Trinity Bellwoods Park have agreed to come indoors so that they will have safe housing. They will get the supports they need. We are as compassionate in this city and have done as much for this group of people as you could possibly imagine, including the biggest push probably ever in the history of the city on building more supportive housing, with the help, I should add, of the federal and provincial governments. But we still have a long way to go. I'll point out one more thing. There is a situation that has existed in these parks for some time, where there are far more of these structures taking up space in the public parks that could otherwise be devoted to the use of the public, including kids and families with summer programs that are yet to come. There are far more of the structures than there are people. And we have been obstructed, I will use that word, we've been obstructed and prevented from even taking the empty tents that are in no use, or empty structures that exist in the park which are not supposed to be there. We have been prevented from taking those out. And when we asked even if we could just move some of the empty tents, let alone move people, we were told no, we could not do that. We were told that by protesters, effectively, that just said they couldn't do that. And I'm sorry, I cannot accept a state of affairs where a group of people like that determine that they have the right to say what is going to be done in our public parks and what isn't, and that even in the cause of standing up for the people who are experiencing homelessness, who we're standing up for too, by offering to provide them all kinds of supports, that they have the right to tell us we can't take empty tents and empty structures that are unsafe and unhealthy out of those parks. So there does come a time when the enforcement people have to make their own decision as to when they have to take some action to say that we can't let this situation continue because of the fires, because of the threats to safety and health, and they have done so this morning. and I think they're doing it in as measured and balanced a way as they can, and I support that action, and I hope that people will cooperate with that and decide that it is time to take a step other than just having the status quo stay in place forever and ever with dozens and dozens and dozens of tents and structures empty sitting in those parks.